was the one who started the study dun sa Long Beach. He himself had a stroke, and he forced his cardiologist to put him in less than 24 hours. Though hindi nga siya safe, especially with really chronically ill patients. Normally with this soft chamber, and especially outside of the hospital siya, when we saw our patients with stroke, again based on the severity of the illness, our recommendation is normally mga 20 to 30 dives. We call it dives because partial. So normally 20 to 30, but what I tell the patient, most of them of course medyo constrained. This is again additional to them as compared to the medicines and the physical therapy. So what I tell them is, let's see day to day how you feel. Let's probably do a minimum of 5 dives, and let's see if you see any progress, any improvement of whatsoever in your sleep pattern, in movement, in your strength. Then if you want to continue, yes. But these are the recommendations, which is 20 to 30. And of course, depends on the severity of the injury to the certain area, and the certain area which is injured also.
On a daily basis?
Best would be daily, yes. Normally daily, 60 to 90 minutes, depends on the protocol. But yes, the best effect would be daily. Of course, for those patients who, let's say, come from Cavite, come from further areas, we would say, kung hindi mo kaya talaga daily, ang pinaka-recommended is maybe every other day, but longer period. So kung 60 minutes lang every day, probably 90 minutes every other day. Just
how about for children? Children with special needs.
Yeah.
How often and how long?
The recommendations by the study was 40 to 80 dives. Medyo matagal siya. No? 40 to 80, and then they have a break of probably a few months. Again, for me, when I talk to the parents, I say, if you see improvement and you're happy, then okay, let's wait there. If you see na parang bumabalik ulit yung symptoms niya, then let's go. So we know how long. So I don't really want to stick to a certain protocol, because again, 40 to 80 dives in a break of 2 months and then another 80 dives, medyo very pagod yun sa both the child and the parents. So I would always say na day-to-day basis, we'll see how they improve.
Yes. On a weekly basis, is it every day, and then let's say from Monday to Thursday, or may break pwede?
If you're going to follow the protocol which is given based on, again, research, every day talaga siya.
Every day. Pero I read somewhere na in a week, more times would be okay.
Yeah, minimum. But
Pero
again,
ano siya, consistent na every day?
Yes, but if you want a good effect, the study mentioned every day talaga na 4 days.
Every day, as in like 7 days a week. No vacation. Wala.
Wala sinabing gano'n eh.
May vacation si Ella Wednesday.
Pwede naman. Pero again, these recommendations mentioned strict. If you really want to see the best effect.
So, in terms of maximum dives, how many? Like my child is 120 dives na siya, diba? Parang nasa 100 plus dives na siya. And I've seen a lot of good results. Actually, just to share it with moms who's going to have it first time, ano siya, may sensory integration dysfunction siya. So, he's very sensitive to hearing yung loud noises, lights, group of people. So, when he did his dive, mga first, pag nagpunta kami sa mall, nakayuko, nakasubsob yung ulo sa akin. So, he's very afraid of yung mga loud noises na. So, first dive, nakaangat na yung ulo niya. He was he was with me in the mall. Parang first time niyang na-feel yung safety sa loob ng maraming tao, and at the same time yung ingay. Tapos nung after 80 to 100 dives, may bubbling na, although it's in conjunction with other biomedical therapy. So it really works. Yun lang, Doc. Parang with regard to oxidative stress, can you say something about
Yung studies in regards to oxygen toxicity was based on the hard shell. Kasi 2.8 siya eh. As compared to the soft shell, ang maximum niya is almost 1.4 lang na pressure. Wala sila masyadong nakitang based on studies dun din sa long term, as long as almost mga 200 to 300 dives. Wala sila nakitang mga toxic effects with the soft chamber. again, I would be cautious with regards to the hard shell kasi medyo pwede tumaas yun ng mga almost 3 or even 4 ATA, which is very high. So, doon na sila nakakita ng mga oxygen toxicity with regards to the eyes, with regards to sometimes GI upset, etc. But soft shell, which is your child, hindi